we're going to start by setting the stage, describing what we call tomographic imaging and the cross-sectional planes that we use to evaluate the spine. Then we're going to talk about cervical spine MRI. We'll talk about the CAT scan. We will talk about dynamic x-rays. And then finally, we'll talk about the role of CT myelography. So tomographic imaging is any type of imaging that allows you to look at a three-dimensional structure. When you look at this patient who's kind of facing you, you can take three different types of slices, and those are the medical planes that we generally look at. Probably the single most valuable study that you can get of the cervical spine is the cervical MRI. So for example, if you look at this image here, this is a T2 sagittal sequence MRI. But then not everybody has to be traumatic. You can often find people, this is a CAT scan through somebody with just advanced degenerative disease or cervical spondylosis. So you're lying flat and you're static and you're seeing what your spine looks like in that static condition. So what do you think you miss in that? All of those would preclude people from getting an MRI, and in those situations we get a study called a myelogram.